Order. I will call Sarah Bull to move the motion, and I will then call the Minister to respond. There will not be an opportunity for the member in charge to wind up, as is the convention. Order, order. Sarah Bull to move the motion.
Thank you, Madam Chair. It's a pleasure to serve under your chairmanship. I beg to move this House considers diabetes treatments. Madam Chair, on the 21st of May 2021, my world changed forever when I was diagnosed with type 1 diabetes at the age of 33. Whilst mine was a shock, given the late onset, the feelings of fear, disbelief and sadness are ones that all those diagnosed share, young or old, with type 1 or type 2. Diabetes is a complicated condition which has been done the great disservice of being stigmatised through misunderstanding. It's not necessarily that we've eaten too many sweets or not looked after ourselves. Type 1 is an autoimmune condition. We did nothing to cause it, and you can develop it later in life, as Mr. Speaker and myself can attest to. Type 2 is not just for the over 40s and the unfit. You can be slim and active, like Sir Steve Redgrave, and still be diagnosed. So this is why I've called for this debate today. Breaking down the stigma and investing in early treatment of diabetes is so important to allow patients to live fulfilled lives and to do so in the most long-term, cost-efficient manner for the government. Our understanding of how to treat diabetes has come on leaps and bounds since the discovery of insulin back in 1921, but there is still so much more that we can do. 5.6 million people in the UK are diagnosed with diabetes. That includes 4,329 people in my constituency of South Northamptonshire, more than 6% of the population. However, just 54% of my constituents with diabetes received all 8 of their essential checks last year, which are important to identify and prevent future complications. The total cost of diabetes to the NHS in the UK is estimated at £10.7 billion. 60% of that is spent on the costs of diabetes complications. Every week, complications from diabetes lead to 2,990 cases of heart failure, more than 184 amputations, 930 strokes, and 660 heart attacks. But these should be preventable with the right education, the right support, and the right attitude from individuals and the government. Now, there is so much that I could talk to on diabetes, but this is a short debate. So my initial asks of the government today in relation to type 1 are that we end the postcode lottery with equitable treatment for those living with diabetes wherever they live in the UK. Yes, of course.
Can I commend the Honourable Lady for bringing this forward? In our discussion beforehand, I declared an interest. I'm a type 2 diabetic. I was informing the Honourable Lady beforehand that when I was first diagnosed some 18 years ago, believe it or not, I was at least 17 stone and probably getting bigger by the minute. I went on a diet because that was what the doctor recommended. I'm down to a nice trim 13 and a quarter stone. But I'm thankful for the NHS and the treatment offered. However, there's a very clear disparity between treatment offered in different areas of the United Kingdom. Does the Honourable Lady not agree that diabetes does not have to be a death sentence, but it also does not have to adversely affect the quality of life either? And that we must ensure, no matter where you are in this great United Kingdom of Great Britain and Northern Ireland, you should get a level of diabetic care which enables you to live life to the fullest. Does the Honourable Lady agree to that?
Sarah Bull.
Absolutely, I totally agree with my honourable friend, and you make a very powerful point. It very much does not have to be a death sentence. It can even lead you to number 10 Downing Street if you are Baroness May, so it shouldn't stop anyone from achieving anything. But back to my other asks for type 1, we must also commit to greater access to technology for diabetes, like the hybrid closed-loop technology, and increase awareness of the condition and treatments in schools and amongst the public. And finally, we also want to see the expanded early testing of type 1 diabetes to identify children who are living with this condition to make sure that they and their families get the right support. Now, Honourable and Right Honourable Members, I'd like to apologise in advance if I suddenly start to beep during this debate or in the chamber in the future. Members can be assured that this is not because I'm some form of 21st century R2-D2. It is because I wear an insulin pump and sensors, and when my blood sugar is running low, it will give me an alert so that I can consume a life-saving sugary treat. Now, this hybrid closed-loop system, or HCL, has dramatically improved the quality of my life with type 1. And it doesn't just benefit adults like me with diabetes. I know that there are parents of young children with an HCL who feel that they can finally sleep at night without fear of missing a nighttime low blood sugar for their little ones. Now, type 1 is also a condition that creates a serious mental burden on those that live with it and their loved ones. As a condition where your pancreas stops working and you no longer produce insulin, it therefore requires constant thoughts and calculations alongside your normal day's activities. So each day, you're assessing how many carbohydrates there are in your food, how much insulin you should dose, taking into account whether you have or will be exercising or just generally rushing around, how hot or cold it is, how tired you are, how stressed you are, and I say public speaking adds into the mix, and for women in particular, what your hormones are doing. And, as I say, when you have that low blood sugar, how quickly can you access a sugary supply? Now, my insulin pump and sensor has ensured that many of these burdens has been eased, and I just wish that more of my fellow diabetics had the same opportunity. I know of one lady from the southwest of England whose local ICB did not prescribe HCLs, and so she had to move to London, away from her support network, just in order to be able to access this vital technology. And this cannot be right. So as part of building an NHS fit for the future, ministers should ensure that wherever you are in the UK, you can access vital treatments for diabetes like the HCL. There are also other treatments that the government should commit to exploring fully too, such as early detection and new drugs. So like me, over 80% of type 1 diagnoses occur in people with no known family connection of type 1 diabetes. And many people are not aware of the 4 T symptoms that you should look out for: thirst, toilet, tiredness, and thin. So early detection is therefore vital in preventing complications such as diabetic ketoacidosis, which 1 in 4 children with type 1 are diagnosed with, and that can be lethal. It can also identify people who would benefit from early intervention clinical trials and treatments. The ELSA study is a programme funded by Breakthrough T1D that offers children between the ages of 3 and 13 a simple finger-stick blood test to determine their risk of developing type 1 diabetes. And this study is currently open to families across England, Scotland, Wales and Northern Ireland, with over 20,000 children having been screened so far. And I would ask the government that it works to have the programme expanded and implemented on the NHS nationwide, as it could drastically reduce the instances of future complications from type 1. Of course.
One of the things that we've noticed back home in Northern Ireland, Madam Deputy Chair and Minister as well, is the fact that even if you get a type 1 diabetic analysis or diagnosis early on, it doesn't mean that your life's over. It means you can still go on. And for those young children, and we have a very, very high prevalence of young children in Northern Ireland who have type 1 diabetes, it's rather scary, but it's a fact of life. And I've seen some of those young boys and young girls just growing up and the diabetes hasn't affected their life at all. So it's important to know that diabetes early on diagnosis still can make sure that your life can go on. You can have a normal life and have a family and work away.
Sarah Boole.
I absolutely concur with my honourable friend. He is absolutely right. You can live a fulfilling life and fulfilled life, but you do need a little bit more help along the way. But if we get that at the right time, it can literally transform your life, and I can live like everyone else in their normal fashion. One of the other new promising treatments that is coming forward, actually, is teplizumab, which will delay the onset of type 1 in children by an average of 3 years. Now, approved by the FDA for use in the US in 2022, it is about to start the technological appraisal by NICE. Now, in conjunction with the National Early Detection Programme, teplizumab could drastically reduce the complications associated with type 1. And with the rise of social media, we have seen an ever-growing societal preoccupation with body image. Now, earlier this year, Baroness Theresa May and Sir George Howth released a parliamentary report into type 1 and disordered eating, which is also known as TIDE. Now, TIDE is an eating disorder where you may restrict your insulin to lose weight, or where you experience an eating disorder like bulimia or anorexia alongside type 1. And the evidence suggests that up to 40% of women and girls and up to 15% of men and boys with diabetes experience some form of disordered eating. So we really must continue Baroness May and Sir George's work in raising the profile of diabetes and its complications. Therefore, in relation to type 1, I ask that the Minister ensures that the Government works with the NHS to increase awareness of the hybrid closed-loop technology, particularly amongst lower socio-economic groups, and fund the rollout of it nationally, provide comprehensive training for healthcare practitioners on HCL technology, and establish a national diabetes registry to support the technology adoption and track health outcomes. Now, to quickly turn to type 2 diabetes. Honourable and right honourable members will have heard a lot about, and may even have been tempted by, Ozempic and Wegovy, known as the GLP-1 medications that are seemingly magic solutions that have helped many in the public eye to shed those unwanted pounds. However, this class of medication is an important treatment for those with type 2 diabetes, as it is prescribed to lower blood glucose levels. Now, my concern, and that of some of my constituents who have written to me, is that there is a real risk of shortage of these medicines for type 2 diabetics whilst it's being prescribed for weight loss. So it is really essential that the supply of these drugs are protected for diabetics. And I would ask the Minister to take actions to ensure that everyone with or at risk of type 2 diabetes can access the medications that they could benefit from. Equally, alongside medications, we should be ensuring that newly diagnosed type 2 diabetics are given the right support. In some cases, it is possible to put type 2 into remission, and it is essential, therefore, that access to evidence-based services such as the NHS Path to Remission programme is increased for people within the first 3 years of their diagnosis. Likewise, people under the age of 40 with type 2 are at increased risk of developing diabetic complications, but are less likely to receive their essential care. Now, the NHS Type 2 Diabetes in the Young T2 Day programme provides extra support for this group, including confirmation of diagnosis, additional checks, contraception and preconception planning, and assessment of cardiovascular risk. And the Government must commit to sustaining long-term funding for this programme to ensure that the rise in type 2 diabetes in working-age adults does not lead to a drastic increase in serious complications. There are also inequalities across the diagnosis of diabetes. Those living in deprivation, or separately people of Black or South Asian ethnicity, are more likely to develop type 2 diabetes, but are less likely to receive their diabetes care and go on to experience worse health outcomes. As the Government plans its plan for its NHS, it should use health inequality impact assessments for all diabetes-related policies to understand how reforms affect different groups. Now, as the Honourable and Right Honourable members may have worked out by now, I really could speak about diabetes all the way to the moment of interruption this evening, but I will draw to a close for the moment. Acting as our own pancreas is hard, and our illness requires 24-hour attention. Diabetes treatment is relentless, but so are we.
Minister Smith. Oh, sorry. Order, order. The question is that this House has considered diabetes treatments. Minister Smith.
Thank you, Mrs Harrison. It's a pleasure to serve under your chairmanship. And I'd really like to start by welcoming the Honourable Lady to this place. I've not had a chance to do that, but also really thanking her for securing this debate and sharing her own personal experience. That's very powerful, and her talk about fear and disbelief and indeed sadness of that diagnosis, I think, is really powerful about her own experience, because more than 4.9 million people in the UK have diabetes, and 2 million people are now at risk of type 2 diabetes. And the impact on the health and well-being of the nation, on the lives of people with diabetes and their families, cannot be overstated. And I think she's done a superb job of doing that this morning. A central mission of this government is to build a health service and care system fit for the future. And as part of this, tackling preventable ill health, such as type 2 diabetes, is crucial. At the same time, we want to ensure that people with type 1 and 2 diabetes receive the best possible care so they can live healthier lives wherever they live in the United Kingdom. As the Honourable Member has mentioned, central to people with diabetes living well is ensuring they have access to annual diabetes reviews that cover the 8 processes recommended by NICE. Annual diabetic reviews are associated with reduced emergency admissions, amputations, retinopathy and mortality. But in 2019, only 42% of people with type 1 diabetes were receiving all 8 health checks, with this figure dropping significantly during the COVID-19 pandemic. Now, the NHS has worked hard to recover these services, and the proportion of people with type 1 diabetes receiving all 8 care processes reached 43.3%, and 62.3% for type 2 diabetes in 23-24. So whilst this is an improvement, in order to drive faster uptake, the NHS is now investing £14.5 million over the next 2 years to support up to 140,000 people aged 18 to 39 to receive additional tailored health checks from healthcare staff. Now, this will include support which helps break down any stigma associated with the disease and support people with diabetes management, such as blood sugar level control, weight management and cardiovascular risk minimisation. And I want to draw attention to that, what she said about stigma. I think that's really important. I mean, I've got my best friend from university, aged in their early 20s. I remember when she was diagnosed some time ago. She won't thank me for that. But family and constituents with type 1, I've learnt a lot from them and how important it is to look after yourself, but the care that you need. And I'd also commend Baroness May and Sir George Howard. They were a formidable duo in Parliament, raising that awareness of what you can do, what is possible, and they're both great servants of their respective parties, and they will continue that work, I know. But technology also plays a critical role in helping people with diabetes live healthier lives, and I'm pleased to hear the personal impact a hybrid closed-loop or HCL system has had on the Honourable Member's life. As many will be aware, NICE has made recommendations on offering real-time continuous glucose monitoring and hybrid closed-loop technology to adults and children with type 1 and type 2 diabetes. The NHS is making progress, with over 65% of people with type 1 diabetes currently using glucose monitoring to help manage their condition, and I expect to see similar rapid progress made for people with type 2 diabetes. Now, following NICE's final guidance in December 2023 on HCL systems, NHS England has developed a 5-year national strategy with guidance to NHS providers on a phased uptake approach for delivering this life-changing technology to eligible diabetes patients. And I'm sure the Honourable Member and others will be watching that rollout very closely. It started this April with an initial focus on children, young people, pregnant women, or those planning to become pregnant, and adults already using pumps who want to transition to a HCL system. Now, I understand that this longer implementation period is because of a need to build essential workforce competencies within specialist adult services. To ensure patients are safe, NHS Trust should only provide HCLs if they have access to specialist trained clinical staff experienced in providing insulin pumps and continuous glucose monitors for type 1 diabetes. Now, I know for many people waiting to access this technology, it's causing distress, and I want to ensure the Honourable Member that NHS progress in delivering these technologies is a matter of key importance to this government. I also want to thank her for raising the important issue of type 1 and disordered eating. NHS England has provided funding for 8 integrated care boards to support the development and establishment of type 1 disordered eating services in every NHS region. NHS England is drawing on learning from the existing services, other emerging evidence and the findings of recent parliamentary inquiry to ensure all areas of the country are supported to improve care for those identified as having type 1 disordered eating. On the matter of type 2 diabetes, Ms Harris, the Honourable Member expressed concerns about access to GLP-1 medications such as Ozempic used to treat diabetes. Now, following intensive work with industry, the broad supply position for GLP-1 medications in the United Kingdom has improved. However, global supply issues remain with specific medicines, including Ozempic. We do continue to work closely with manufacturers and others in the supply chain to help ensure the continued supply of GLP-1 receptor agnostics for UK patients and to resolve the remaining supply issues as quickly as possible, for example, by asking suppliers to expedite deliveries. Turning to prevention and the support available for people to put their type 2 diabetes into remission, which, as she outlined, is possible. And in fact, I canvassed somebody last weekend who was very proud of their ability to do that, so it's great work. Lord Darcy's report on the NHS published last month noted the worrying increase in prevalence of people with type 2 diabetes and the necessity of prevention. The prevention of diseases, including diabetes, is a priority for this government. The NHS Healthier EU Diabetes Prevention Programme supports people at risk of developing type 2 diabetes to make lifestyle changes either through face-to-face group programmes or digital services, and this programme reduces the risk of type 2 diabetes by 40%. The programme has also been working to raise awareness amongst the diabetes healthcare professional community about the growing numbers of children and young adults with type 2 diabetes, and we've heard about that today. Healthcare professionals do need to understand the more aggressive nature of early onset type 2 diabetes compared to older onset type 2 diabetes to support earlier diagnosis. Further, given the inequalities, which again was mentioned in her comments, in who develops type 2 diabetes and the poorer outcomes for those of South Asian and black ethnicity, people of black ethnicity, the NHS has established a focused engagement campaign using social media and more traditional approaches to raise awareness and boost uptake from these groups. Living with type 2 diabetes is not inevitable if early action is taken to live a healthier life. As the Honourable Member has raised, the NHS Type 2 Diabetes Path to Remission programme is a joint initiative between NHS England and Diabetes UK. It provides a low-calorie diet and support to people recently diagnosed with type 2 diabetes who are living with obesity or are overweight. This year, the programme has been expanded to make it available across all of England, enabling more people to benefit and recover from type 2 diabetes. The Honourable Lady asked specifically about the ELSA study, which I understand is recruiting 20,000 children in the UK to better understand the potential benefits of screening for type 1 diabetes. Now, I understand the University of Bristol, in my home city, has also undertaken a similar study looking at the risk of type 1 diabetes in adults, and the government looks forward to seeing the outcome of both these studies to help inform future policy making. Mrs Harris, by moving from sickness to prevention, the government wants to shorten the amount of time people spend in ill health and preventing illnesses before they happen. This is one of the goals of reform in the NHS, which will be part of the government's 10-year plan, and I know the Honourable Lady will be contributing to this debate for her time in the rest of this Parliament. Thank you.
The question is that this House has considered diabetic treatments. As many of that opinion say aye. Of the contrary, no. I think the ayes have it. Order, order. The sitting is suspended until 2:30.